much thicker than the vena cava. The vena cava is almost paper thin. You always have pressure on the inside of your chest, right? Your chest is a closed space, and I'm talking about your entire chest cavity, right? So it's a closed space. And it moves a little bit when we, breathe in and our chest expands, our diaphragm drops, but essentially it's a fixed space. If we inflate the lungs and we never let that air get out, that intrathoracic or inside the chest pressure is going to be pretty high, right? Because we filled our lungs with air, that spongy tissue is expanded, there's air in there, and it creates pressure, and that pressure pushes down on things. It doesn't compress the aorta. It's an Aldente piece of rigatoni that's nice and firm. But what it does to the vena cava, the mushy piece of rigatoni after all the veno, it compresses that. And when we compress the vena cava, we reduce the amount of blood that comes back to the heart. Not enough blood comes back to the heart. Not enough blood gets into pulmonary circulation to participate in gas exchange. And then ultimately, you're not going to have that much cardiac output. That is a huge, huge, huge concept. And I can tell you, I got doctors who can't figure this out. All right? We're going to talk about ventilating patients and how hyperventilation is bad because of that reason. We'll talk about people with, everybody has heard of what a pneumothorax is. You get air inside the chest where it's not supposed to be. That creates pressure that compresses the vena cava. So like this vena cava stuff, this mushy rigatoni is so important. You guys are going to be like way ahead of the game because you know about rigatoni, veno, aldente, and the status of your cardiovascular system. So bear with me on that. When we talk about the individual situations, that'll become crystal clear to you. Any questions about that so far? All right, we really needed to review that before we go on further, right? So then you have your diaphragm here. That's like that big muscle that does the majority of work of breathing for us. That goes down. It pulls a lot of that spongy lung tissue with it. It creates a negative pressure inside your lungs, and that causes us to bring air in. Now, in order to bring air in, we need to have a mouth or a nose that's open, right? If anything's obstructing that, whether it be the tongue, an unchewed piece of rigatoni, or maybe a meatball, blood, vomitus, whatever, a golf ball. Anybody watch 1,000 Ways to Die? No. Anybody see the one where the girl was like fishing, she catches the fish and it goes in her mouth but she can't pull it out because of the scales or whatever?
Oh my God.
And it's terrible. But anyway, so you get a fish in there, a whole fish, that would prevent air from coming in and out. So just keep that in mind. So now, in all seriousness, so that's the diaphragm. Also remember that